Welcome back to the World Extreme Medicine podcast. My name's Will Duffin, GP and Education Lead. Are you a paramedic, doctor, nurse, or health professional looking to connect with other like-minded people who also want to follow a diverse and adventurous career? If so, then you're in the right place. In this podcast series, we're talking to both medical and non-medical high performers who are sharing their stories and expertise. Today's big topic is technology in healthcare. And to explore this with me, our guest today is Stacy Welker. Stacy's a registered nurse based in St. George's, Utah. She's a trauma practitioner and acute care surgeon's first assistant, dealing with critically ill patients every day. And she can sometimes be found lecturing on trauma care for Dixie State University. Stacy's also the Vice President of Clinical Services for a telemedicine company, that's Remote Health Solutions. And she allows medical access to military, corporate, airline, remote and austere environments, alongside also remote patient monitoring for chronically ill patients. Stacy, welcome to the podcast.
Thanks, Will. I appreciate you having me on today.
Yeah, it's great to have you. And it sounds, with this current pandemic, that you are absolutely in the right industry.
Yeah, we really are. It's been very busy. It's a very exciting time for us right now. Like you said, it's very new. The technology is great, and we're really hoping we can help.
Yeah,
with this pandemic.
absolutely. Do you think that one of the huge positives that will come out of this pandemic is that it will accelerate the use of technology in healthcare in general?
Yes, definitely. We believe that technology is the future of medicine. I mean, we're seeing this throughout the military, as well as remote patient monitoring with our chronically ill patients. And now with COVID-19, we're really seeing that we can make a big impact with telemedicine within hospitals and ICUs to really be able to protect our healthcare providers and provide good patient care.
Yeah. And what amazes me about some of the technology you've been working on is the broad scope. So you provide technology not just for conventional patient care in hospital clinics and inpatient care, you also for quite remote and austere environments. So some really kind of rugged tech that's meant to withstand some quite harsh environments.
Yeah, definitely. In fact, when Adam Hartage, our CEO, and Dr. John Baugh, our Chief Medical Officer, started this company, it was really intended for downrange military medics. We wanted to be able to help them treat at the point of injury. So we have devices specifically for point of care, austere environments. We have larger kits for prolonged field care and things that can be used out really in the back of a rig or a helicopter or anything like that. So it is very robust, and our connectability is far beyond any other technology out there. So we're able to connect in pretty much any way you can think of. So,
yeah, you can take this stuff anywhere. That's amazing.
Yeah.
So in terms of telehealth, what do you think in what way do you think that's a huge enabler in healthcare? How is that going to change the way we practice in kind of day-to-day healthcare?
Well, I think there's a lot of different ways. One being that we're just short providers. There's not enough physicians, at least in the United States. There's not enough physicians. There's not enough nurse practitioners to really take care of the population, our aging population. So technology really has to take over to help with that problem. So what we're seeing is telemedicine coming out and being a real promising avenue to really treat patients. Whether it's scheduling telemedicine visits so you can see more patients, or sending them home with a small device to monitor them daily to keep them out of the hospital. So there's a lot of different avenues that we can use telemedicine for. And I do think it is the future of medicine. So there's a lot of things we can do with our technology to be able to really run diagnostic testing and not just a simple FaceTime video.
Yeah, because at the moment, certainly my experience of telehealth in my work as a GP, We've just started consulting using Zoom type platforms. So it's very basic video consulting. And we're all just getting the hang of that. I think it's the whole etiquette around consulting remotely is very different. I think clinicians and patients are currently really adjusting to that. But some of the stuff that you've been working on offers lots of additional things, not just that video contact. What other kind of added features are there that you've been working on?
Right. So some of our larger kits, we can run a 12 lead EKG, so the physician can actually be watching a patient, looking at them, seeing if they're cold, diaphoretic, short of breath, while they're seeing a live EKG come across. We can do spirometry. We can do full vital signs. We can do otoscope and ophthalmoscopes just with our kits and devices. So the physician on the other side is seeing everything that's being done in real time. We even have the capability of assisting in video laryngoscope to help intubate a patient. And you can do this from across the world and actually see the cords and help walk someone through that.
I mean, that's phenomenal. So you're moving to a point where the physician can be completely remote, but can do quite advanced examinations and investigations, EKGs, ECGs, and otoscopy and laryngoscopy from 1,000 miles away. That's unbelievable.
Right, right. It's very exciting for us. Yeah, we're pretty proud of our technology and
Yeah,
where we're going with this. So.
yeah. I mean, do you think what is the end game for this? Do you think this will ultimately enable remote consulting to replace face-to-face clinical contact?
I don't think that it will replace. I think it has definitely a place in medicine. I also think that there's something to be said with a provider at the bedside. I think it's definitely needed in situations where you still should have patient contact. But if we can do things remotely, say like if with COVID-19 to keep our healthcare providers safe, then I think we should. So I think I think it's complementary to a bedside provider.
Sure, absolutely. I mean, from a clinician's point of view, I personally feel that there's huge added value to that face-to-face contact for certain patients, and in terms of job satisfaction as well. So much of our life now revolves around screens. It's a really nice, really valuable part of my work to see people in the flesh, and I certainly hope that we never fully replace that with these technologies. But I totally agree. I think they can be a huge asset.
Yeah, I think so. I think as far as like our older population, the patients we do remote patient monitoring and chronic care management with, and we send them home with a small iPad-sized device, it gives them a little bit more sense of security because sometimes they aren't able to get in to see their GP and they just need to have their vital signs checked every day. They need to check in with the nurse so that they feel secure, they feel safe, they feel like they have someone to reach out to if they start to have a health issue. So I think that also gives a little bit of peace of mind and decreases some anxiety, especially in our chronically ill patient population.
Yes, absolutely. And I think particularly in terms of chronic disease management, particularly elderly patients who are at home and especially now who are self-isolating, having access to their vital signs can be a really helpful decision-making tool, especially things like oxygen saturations. That can, especially with coronavirus, that is a hugely important piece of clinical information that the only way we can access that at the moment is by physically going to see the patient or a district nurse going to them. And there's huge issues with that, exposing them further to potential coronavirus, and also is very resource heavy, sending people out to them just to get their vital signs. So I mean, a bit of tech that can do that, that's immensely powerful.
Yeah, it really is. In fact, we think that we were the first company to actually monitor a patient at home that was under investigation for COVID, and which is kind of interesting. It's actually one of our ER physicians that I work with. He had been out of the country and come home and had some symptoms and had passed through Hong Kong and came into the emergency department to see if he could get tested. He wasn't sick enough to be admitted, but we sent him home with one of our devices. He checked his vital signs a couple of times a day. Our nurse reached out to him. He's an emergency physician who took our technology to heart, and he said he felt very comfortable being able to check his own vital signs and having a nurse just check in on him to make sure he was doing okay. So
Mm.
I think it's very beneficial.
Yeah, so that it's interesting that that worked with a patient who was also an emergency department physician. The one of the big issues with uh, spreading this kind of technology, particularly within elderly, frail patients, is perhaps they're not au fait with some of this technology. There's a huge barrier to them accessing this, and do you think that has that been a big challenge when you're trying to get this used in that patient group?
Initially we kind of worried about that, but the way our technology is set up, it's very, very simple. I can show you a small device that we send home to our elderly population. I'm not sure if you can see it
Go
real
ahead.
well or not,
Yeah.
but it's a small iPad-sized device that just has a lot of icons. It's very user friendly. So it says temperature. You hit the temperature and you use the probe in your ear, and it records. It's all Bluetooth. So it uploads right into our cloud and then pushes right to the electronic health record. So the GP has access to that at any time the patient's taking their vitals, and then can request a visit right then. So it's actually been interesting. We've had a lot of elderly patients say, wow, this is great. This is easy. I'm not having any challenges with this. And they can take it with them if they go see their grandkids, or they decide they want to go on a cruise. They can take this with them to make sure that they're doing okay. So it's very simple, user friendly. It walks you through if the blood pressure cuff needs to be adjusted. It's very easy to use. So
Yeah. Yeah, great. And I can see that user interface you've just showed me does seem very, very intuitive. One pitfall I can envisage with this is perhaps patients who are compulsively checking their vital signs when then perhaps not that unwell, and perhaps they are getting some anomalous readings. They perhaps getting low sats because the probe isn't on properly. Is there a risk that that can create a lot of unnecessary workload for clinicians and also anxiety for patients?
right, definitely. The way we have our products set up is they're patient specific. So if you have a patient that has congestive heart failure, we're going to have parameters that are set up right for that patient. So if they're checking their vital signs, say 10 times a day, and we're seeing a lot of fluctuations, our nurses will actually be alerted and they will contact the patient via the telemedicine, the VER technology, and be able to see them face to face, make sure that they're putting the blood pressure cuff on correctly, making sure that sat monitor is on correctly. So we try to intervene quicker than having them just rush off to the emergency department. So we have 3 alerts that we have programmed into our system: a red alert, a yellow alert, and a green alert. So even if the patient doesn't check their vital signs, we're going to get an alert to say, you know what, they're not being compliant. We need to reach out and see why. So there's a lot of reasons and alerts that we can kind of watch, and we can watch trends over time, which is another big thing. So the patients had great blood pressure for 5 days, and then all of a sudden their blood pressure is sky high, and we can intervene and say, have you been taking your blood pressure medication?
Yeah.
So yeah.
Absolutely, I mean, and that's a big thing of what we do in as GPs is monitoring blood pressure, and we know that clinic blood pressure is not often a very good reflection of what the true blood pressure is at home. And also with patients with severe hypertension, we never really know, is this an acute finding or have they been sitting on this for a long time? And I think having that historical data would be a really powerful decision making tool.
Yeah, it really is. It's kind of what we think in the emergency department. We don't care about one blood pressure being high, but what's your trend been over time? So
Yeah, absolutely. Yeah, and another issue that I found with a lot of this tech, and I'm a real tech head. I'm an early adopter of all this kind of stuff. However, we have a lot of different computer programs and technologies that we're trying out at the moment in the NHS, and certainly as a GP. And the problem with some of these different programs is they don't really talk to each other. And they often conflict with each other, and you have to remember about 500 different passwords, and it quickly gets a bit out of hand. How have you managed to kind of solve that side of things?
So with our products, we have a clinician portal, a patient portal that the clinician can go into at any time. They don't need a specific device. They just need a Google Chrome browser, and they just log into the portal. It's as simple as that. They can click on what patients they have and connect with their patient like that. All the vital signs diagnostic data goes right up into our cyber secure cloud and then is pushed into that electronic health record. And as long as you're using an HL7 interface for your electronic health record, we have no problem communicating with that.
I see. I see. Now, the problem with UK general practice is that we have about 5 different systems
Right.
that different practices work on. Hospitals in the UK still on paper notes on the whole.
Oh,
Yeah, I know. As per, if we were normally miles behind the healthcare in the US, so I
yeah,
don't
paper
know
might
how
be a
that would
little bit
work.
difficult.
Yeah.
But yeah, like we have a lot of different systems here within the US as well.
Mm,
Epic and Cerner and point click care and all sorts of different ones. And we're able to interface with those. So
yeah.
as long as you are a provider that is connected to that patient, we should be able to get you
You can
access to their
find,
records.
yeah, you can find ways around
Yeah,
it.
right.
And thinking about this specific pandemic, are there any other ways that your technology is being used at the moment to keep patients out of hospital to help them be safely managed at home?
So, like I said, we can send home a device with patients. We've
Mm,
talked with different physician groups who are on the front lines of this to work with them on getting these devices within their patients' hands to go home with. I know here in our emergency department, our chief medical officer, John Baugh, he's a doctor that I work with here as well. He has seen one patient several times who's just very nervous. They've been diagnosed with COVID and they're not needing admission to the hospital, but they need some monitoring. And so they've come back into the emergency room several times just out of anxiety. So we're working with groups like that to be able to get those devices in the patient hands so that we can monitor them at home. Another way is to see those patients at time of discharge so that when they're going home, we can send them home for continued monitoring. So those are some of the things we've been doing. We've worked extensively up on Capitol Hill with Health and Human Services here with the CDC in looking at their criteria and being able to coordinate monitoring with that. So
so that's really
I think
powerful.
that
So you
works.
can not only can you prevent unnecessary admission, you can safely monitor patients at home and support them at home, but also it will facilitate earlier discharge.
Right, right. We've done
Yeah.
even just in our, not to kind of change the subject a little bit, but in our chronic care or our chronically ill population, we did a study of 45 patients, looked at their data 6 months prior to using remote patient monitoring, and then the 6 months while we were monitoring them. And we had a 100% reduction in hospital admissions. We only had one patient visit the emergency department within that 6 months, which was a drastic change of what it was the prior 6 months. When the patient was in the emergency department, the only reason why they didn't have hospital admission is because they had remote patient monitoring to go home to and the accessibility of telemedicine. So the emergency physician felt comfortable sending them home. So I think the same thing applies with COVID is yes, you have these patients who are ill and maybe in the hospital for some time, but maybe don't need to be in the hospital for as long as maybe we're keeping them. Maybe they're okay, but we're nervous about this because we don't know yet. We don't know exactly how this virus is gonna go really.
Mm.
So we can kind of intervene sooner. We can send patients home with a device and
Mm.
really keep a close eye on them, monitor their vital signs a couple of times a day, make sure
Yeah.
that they're not having a return of symptoms or fever,
Yeah.
things like that. And if we need to intervene quicker and have them come back, then we certainly can.
Yeah. I think one big reservation that's been raised certainly in the UK about adopting more of these technologies is cost.
Yeah,
We're very carefully rationed use
right.
of our resources in the UK with our National Health Service. What do
Yeah.
you say to that? Because a lot of people will say that this technology is disproportionately expensive and doesn't add a significant value to make it worthwhile. What do you say to that?
Right. I will say remote health solutions, no one can beat us on price, performance, and capabilities. We are far cheaper than any of our competitors out
Yeah.
there. Now, in the United States, I know it's very different than in the UK, and we do have reimbursement for through Medicare and Medicaid for having a device in someone's home. And especially with COVID, we've seen far more CPT codes and billing, rates and reimbursement rates as a result of this new COVID-19. So in the UK, I can see that being something it's a real problem or a real concern for a general practitioner. Here, it's not quite as a concern. They actually practitioners have the ability to make a little bit of money by having their patients have a device in their home. They're able to, get reimbursement on that and have some financial benefit from that.
Yeah, yeah. I mean, I genuinely think, Stacey, that in the US, you're about 10 years ahead of us in healthcare. And I think what you're doing now is inevitably going to be happening in the UK, but it'll just take us a little longer to get
Take some
there.
time. Well, we'd love to help you.
Yeah. So another a huge area of interest at the moment in the kind of technology field is artificial intelligence and the emergence of machine learning through deep neural networks, and the way that computers now have the ability to also to diagnose disease. Is AI something that you're going to be integrating into your telehealth products?
Yes, definitely. It's something that we've talked about quite extensively, and we have started to go down that path a little bit. For instance, with our chronically ill patients who have diabetes, heart failure, hypertension, depression, those type of diagnoses, we have clinical pathways that are set up within our devices, questions that the patient can answer, a couple of times a week, and that will generate alerts and alarms if those answers change drastically. Or say you're watching a patient for depression, you're able to ask certain questions and they can answer this daily, or like I said, 3 times a week, and really see if we're seeing some changes that we need to intervene on. So we've started going down that path already. Another thing that we're doing is we've partnered with a company called Canary Speech, and they're an amazing company that have the ability to make diagnoses just on some simple speech patterns. And they can do this by just listening to the patient for the first time. It's quite remarkable. So we're working with them to integrate this into our system, into our virtual exam, so that when the patient speaks a couple of minutes, we're able to see, okay, well, maybe for a soldier, maybe they have some PTSD going on, or maybe there's some depression. They're
Wow.
able to, yeah, they're able
So,
to see if the
so
patient might have
through
Parkinson's
through
disease.
with a few minutes of audio, that
Yeah.
the that program is able to pick out certain parts of that speech and suggest potential diagnoses just from that
Right.
information.
Yes, it's quite incredible. They've been able to isolate biomarkers and really diagnose patients. It's quite incredible. So we're working closely with them. They're a great company.
Yeah, it's incredible. I mean, it all sounds very science fiction to me, Stacey.
It, I know it does. I know. It's very interesting.
Yeah, but also very cool. And yeah, clearly the direction things are heading in right now.
Yeah, it definitely is. So we're starting down that path. We're not fully down the AI path yet, but
Yes.
we are on our way.
Yeah, some of my colleagues have reacted to our former health secretary famously said that doctors would ultimately be fully automated. We would be replaced by machines within the coming decades. Do you think that's going to happen?
Well, I certainly hope not. I think kind of with telemedicine as well. I think there's room for both.
Yeah.
I think in certain situations, I know in my situation at my hospital, what I do is a lot of trauma care. So I respond to acutely injured patients that require extensive work, and I have a hard time thinking that that could be taken over by a machine.
Mm.
Um,
Yeah. Yeah.
Certainly AI and things like that could help, but there's something to be said for having your hands on the patient and being at
Yeah.
the bedside. So
Yeah.
hopefully
Totally.
there's room for both of us, because otherwise we won't have jobs.
We're out of a job. Yeah. Yeah. So let's talk for a moment about the other dimension to this, and that is working in very remote, austere environments, dealing with acute trauma. Tell us about how your
Sure.
technology has helped in those situations.
Yeah, our technology is amazing for these environments. Like I said, our ability to connect is unmatched. We have the ability to run full diagnostic data, voice, video across a very very low bandwidth. So in an austere environment, it's excellent. We can even use our military's ATAC network, or low bandwidth BGAN to do this. So it's great. We have kits, larger kits, like I said, for prolonged field care, kits that can be in a clinic, a tent clinic. You can take this. I know my business partner, he's been down to Haiti and Dominican Republic several times on humanitarian missions. And he's taken our kits, and he's been on the hillside in Haiti doing a virtual exam just to get reach back to a neurosurgeon back in the States. So this is really helpful for those real austere environments, or areas where patients just don't have access to care in those small little clinics, or they can come into the clinic, or we can reach out to them like that. So yeah, it's very beneficial in austere environments.
Yeah, and you touched there a little bit on perhaps in humanitarian situations where there is huge need, but perhaps not enough expertise on the ground, where
Right.
you can reach back and get the right expertise on
Yeah.
site through digital means.
Hmm.
Have you got any examples of
Yeah.
where that's been used?
Yes, like I was saying, my John Baugh, Dr. Baugh, he's
Yeah,
our chief medical officer. He goes to Haiti quite a bit, and he
yeah,
was seeing a baby in Haiti, and the patients they just don't have any access to care. There's
yeah,
been
yeah.
people down there that haven't even ever seen a physician, and they're 50 years old.
Mm.
But he was seeing a little baby that had a hydrocephalus, and there's no neurosurgeon available, and he needed to get help for this baby. So he was able to reach back to that neurosurgeon and really get help. And I think that that's important too, is it's not just for patients to reach back to us as providers, but for us as providers to reach back and get another set of eyes, or to get a little more help from a specialist or a different specialty. So that's where it's been used. And also in the military, our products were started designed to help those downrange medics that are on the battlefield and need some help. They may have to do a procedure that they haven't done in a very long time, or ever done, and they might need someone to walk them through this on the battlefield. So those real remote austere environments, this technology is amazing, and it gives them great help. So
I say, I wonder how far and how safely you can take this. I mean, there's all the famous stories of passengers being talked through landing a plane when the pilot has been
right.
incapacitated. And I wonder if you would be able to do the same thing with medicine. So if you had a lay person that had to perhaps perform life-saving surgery, do you think there would be a time where they could be talked through that over through a digital means and supported adequately to do a very, say, challenging procedure safely? Do you think that's feasible?
I actually do. I know there's been some work with the augmented reality goggles for surgery, and this has kind of been seen through military and different areas. But you can wear those augmented reality goggles. The physician, the surgeon on the other end of the computer can say, "Okay, I can see exactly where you need to make your
Wow.
cut. This is
Yeah.
how you do it." Especially for a fasciotomy or something like that. But as long as a layperson can have the stomach for it, I think that there is the ability to walk them through those procedures.
Yeah, I mean, that would be quite something. And you just
Yeah, it
touched
would.
there on augmented reality as well. Can you talk us through
Right.
what is augmented reality, and what kind of implication will that have in your field?
So we haven't quite started using this extensively quite yet, but we do have the ability to connect that to our devices. So augmented reality goggles are a kind of a goggle that gives you kind of that a different view, right? You can see different areas. You can see the patient. The physician on the other side can see exactly what you're seeing and actually draw a line where you can see, wearing the goggles, of what you need to
Mm.
do. So it's really just another step of walking a patient through, or walking a provider or a layperson through a procedure. So that we really haven't touched on a whole lot yet, but it's definitely in the near
Mm.
future.
Yeah, I think this is something that Google Glass experimented with, didn't they? So
Yes.
you've got you can see the world through the glasses, but also superimposed on that is
Yes.
information pertinent
Right.
to what's going on in front of you. And I wonder whether you could have a surgeon who's operating where the computer would also see what he's seeing and would be able to
Mhm.
identify important structures in front of him, in front of his eyes, as a
Right.
tool to help him operate more safely.
Yeah,
He could even label all the anatomy for him, and maybe you wouldn't even need to
absolutely.
learn anatomy in the first place if you had this kind of technology. I don't know.
Yeah, I think that's definitely something that will happen. I think you can be able to see protocols and directions
Yeah.
and instructions, step-by-step instructions right there as you're working with a patient. So
Yeah, yeah. I think we're not. It doesn't sound like we're quite there yet, but that seems to be a direction that things might head in.
yeah, I think so.
Yeah. Well, it's all really exciting stuff, Stacey.
Yeah.
It's quite an interesting time to be practicing medicine. There's lots of innovation happening out there.
Yes, there is. It's very exciting.
Yeah. Well, thanks so much for your time chatting to us today. If anyone wants to connect with you and find out more about what you're doing, how can they do that?
They can go to our website. It's rhsusa.com or Remote Health Solutions. You can find me there as well as any of my other coworkers. We're happy to chat. I'm also on LinkedIn, just Stacy Welker, and Facebook as well.
Great stuff. And Stacey will, of course, be joining us at this year's World Extreme Medicine Conference in the autumn. So you can catch up with Stacey there as well. So thanks so much for your time, Stacey.
Yes,
We'll,
thank you, Will. It was great. Great to see you
yeah,
again.
we'll catch up again soon.